Good afternoon. I'm Adrian Dix, BC Minister of Health. Beside me is Dr. Bonnie Henry, our Provincial Health Officer. As we've consistently said, we're going to update you and the people of BC on developments regarding COVID-19. We have an update, and I wanted to introduce Dr. Henry.
Thank you. Thank you very much. So I do want to announce that today we have a new case of COVID-19. So this will be a total of 13 cases that we've had here in British Columbia. This is an individual who is in her 80s and resides in the Vancouver Coastal Health Region and recently returned from travel to India and Hong Kong. Unfortunately, she's had quite a severe illness, and she is currently in critical condition in isolation in the ICU at Vancouver General Hospital. So the hospital, of course, has been preparing for this and has taken all precautions to ensure that everybody in the hospital, the healthcare workers, the visitors, the other patients, are safe and are being protected and providing her the care that she needs at this critical time. So the case is a presumptive positive based on testing that was done at VGH and will be confirmed at the BC CDC. So just to give a recap then, this is our 13th case. As you're aware from our previous discussions, 4 of our cases have previously have now fully recovered, and the others are all in isolation at home and are in stable condition. We have no new contacts who have developed this in the many contacts that we're following, or the small number of contacts that we're following from all of these cases. Vancouver Coastal Health continues to actively investigate this new case and the other ones that we announced in the past couple of days. Close contacts are being identified and contacted and are monitored, those who are at risk. We're supporting them to be in quarantine, to be isolated at home for 14 days and active monitoring for symptoms. As you know, the risk is changing day by day globally, and we are continuing to monitor carefully. We also, within British Columbia, the risk still remains very low in our communities here and in the province in general, and in Canada, the risk remains very low. So we continue to work closely as well with our federal partners around travelers who are returning to Canada and to British Columbia. And currently, we are asking anybody who's returned from Hubei province or from Iran to self-isolate for 14 days. And we are contacting them to ensure that they have the resources and are able to do that. So that's our update for this evening.
80s, yeah.
That's correct, in her 80s.
Yeah, she's in her 80s. Premièrement en français, and then I'll just say a few more words in English. Nous annonçons un nouveau cas de COVID-19 en Colombie-Britannique pour un total de 13 cas. Le 13e cas est une octogénaire qui a récemment voyagé en Inde et à Hong Kong. Elle est mise en quarantaine à l'unité de soins intensifs de Vancouver General Hospital. Les responsables de la santé publique enquêtent activement et tous les contacts étroits ont été identifiés et contactés, ou va être identifiés et contactés. Ceux qui peuvent être à risque d'exposition sont maintenant isolés pendant 14 jours et font l'objet d'un suivi actif quotidien des symptômes. Very clearly, this is a serious situation, our 13th case, and it reflects the seriousness with which the healthcare system takes every single case, and that is reflected in the actions of healthcare professionals, healthcare workers in this case. Obviously, our hearts go out to the family, and we are doing everything we can to support this patient and all of the patients who are dealing with the consequences of COVID-19. As I said in the legislature, part of our preparation, and this is part of that significant preparation since more than a month ago when our emergency response was set up under the direction of Dr. Henry and Stephen Brown, the Deputy Minister of Health, has been to prepare health authorities, and in every health authority, in fact, there's an emergency operations center in operation now to address COVID-19 as we address issues in the future. This preparation, I think, is critically important and will be critically important as we address issues in the coming days and weeks. And I wanted to thank all the members of the public again for their continued support and work on these questions, on their support for people in the community. Obviously, this case is another serious one, and it's why we chose to come here today and again brief you to keep the media and the public informed as to what's going on in our province.
I'm happy to take questions.
Richard?
Questions?
Dr. Henry, generally, are we seeing flu reports up in the province this year, and are more people with the flu visiting their doctors thanks to the concerns around the coronavirus?
Yeah, it's a little bit hard to know because we are seeing quite a lot of influenza, and I'm certain some of it is driven by our recognition and our telling people about coronavirus and about concerns related to it. We're seeing people being tested in a variety of different settings. So yes, many are in private physicians' offices. There's also the urgent care centers and people going to emergency departments. So, yeah.
Aware of any Canadians on board the Grand Princess ship from San Francisco to Mexico and back February 11th to 21st?
Not aware of that yet, no.
Binder and then Keith.
Just wondering, during SARS, I guess there were separate testing clinics, and wondering if the province would consider something like that and what it would take to get to that point.
Yeah, absolutely. I mean, these are the things that we're talking about with the health authorities, and as a matter of fact, had a detailed discussion about some of these issues today. So each health authority and each community is looking at what's the best way to safely get people tested for COVID-19 in particular. And what we've seen an increase since we had the case from Iran in particular. So there are different things being done in different communities, and some are looking at setting up a separate assessment center. We're not at the point yet where we need a lot of those. It's not that much testing. Most of it is being done in the community. Some of it is being done by public health. Some of it is being done by family physicians. And we do really want, for people who have mild illness, we don't want to burden the emergency department. So we've been working with 811 so that they can identify where people can go in the clinic or in the community to be tested for this. So far that's working in most places, but we are planning with each of the health authorities in each community to ramp up how we might do that should we have more cases.
And in the South Asian community, I know a lot of people go to India at this time and come back. Given this case, like I don't know if we know whether this person may have contracted it in India or Hong Kong, but what kinds of precautions or cautions do you think that community should take? Because there are quite a number of people who take that trip.
I know, especially around this time of year. So right now the investigation is ongoing. We're looking at the time period that she and others were on a tour group in India. And so who else was on that group, what kind of exposures they might have had. Currently, India is not reporting a lot of cases. They're reporting mostly sporadic imported cases, though in the last couple of days there's been a slight increase in that. So that's clearly one thing we're investigating. Some of the other people who are on this tour were friends that are now in other parts of Canada or in Hong Kong. The timing of her symptom onset is much more likely to be related to Hong Kong, but we're looking at that as well. So all of those. And regardless, we are working with the Public Health Agency of Canada, and we'll be getting the details of all the people who were on the trip in India. It was a group trip, as I said, so we'll be following each of those and at least warning them and seeing if anybody else is ill, because that will give us a better understanding if that's where her exposure occurred or not.
Keith.
So this 13th case, she's in critical condition. Of the remaining 8 sick people, can you apply a condition to them? Are they serious, fair, good?
All of them are at home, so they're all in stable condition and doing well. And as a matter of fact, there's a couple more that are currently asymptomatic and waiting clearance by having negative lab tests.
And secondly, you sort of just did this, and I think you did it yesterday. We're getting a lot of calls from people wanting to know, what do I do if I feel these symptoms? But you could just walk us through the steps of what an individual should do.
So right now we don't have a lot of this in our community, but we do have other things that cause people to be ill. But even if you traveled and you feel you have symptoms, what you need to do right now is call ahead. Call your physician's office, call 811, and they can help you be safely assessed and tested if needed, and then cared for if needed. And I will say that's exactly what happened in this case. They were tired for a variety of reasons, but stayed at home, didn't have many close contacts at all, and they called ahead to their family physician, and as her condition was getting worse, they called ahead to the emergency department, and the BC ambulance actually took her to the emergency department. Everybody was notified, so they were able to take the appropriate precautions so nobody else was at risk. So that's what we need people to do. Call ahead.
Is 811 24/7?
Yes, it is.
Dirk, Shannon, and Richard.
Hi, I'm Dr. Henry. Kind of a left field question, but can pets get this virus, and are there symptoms?
So there's been a couple of case reports about pets, and yes, a couple of companion animals have been positive in China, and I believe one of them was Hong Kong. What we don't know is they can clearly get it from humans, some animals, but whether they can transmit it to others, it's not clear. Probably not a large source of transmission, if anything, but that is something that we're monitoring, and we do have some information about that up on the BC CDC website. Yeah.
Shannon.
Dr. Henry, I've seen some reporting that they have now identified 2 strains of this virus, one of which seems to be more severe than the other. Are you able to say which one, if either, has been identified in BC, and whether there's been some variety in the cases diagnosed?
So that's a relatively new thing too, and it's unclear exactly whether those markers that they've determined are associated with severity or not. So there's still a lot of discussion amongst the scientists about what that actually means. The short answer is yes, but we're not quite sure yet. So we are doing whole genome sequencing of the viruses that we have here in BC, and I can tell you that the people who have come from China, whose source of disease has been from China, have slightly different genomes than the people who've come from Iran, and that tells us that it probably was circulating in Iran for some time. So this is what we call an RNA virus. So it has a single strand, unlike us with DNA that has 2 strands. So it doesn't have a double checking mechanism. So every time it replicates, it can have errors, spelling errors between the codes in the genetic code. And so the number of errors, or the changes in the genetic code, gives us a sense of how long it's been circulating in the community. And this is one of the things that they were talking about in Washington State, that the person, their very first case, and then the most recent young person who was from the school, that their genetic sequences were very, very similar. It sounds like that it might have not been, it might have been circulating in that community the same, rather than changing. So what we do know is that we are mapping the genomes that we have sequenced here in BC against the new phylogenetic tree. So that's a funny diagram that shows you how closely related everything is. And it's they're not able to tell by what's been published where we actually fit yet. But scientists at the BC CDC are working on this, and it's certainly of great interest whether there's a difference between the strains that we're seeing infecting people that were infected from strains that came from Wuhan versus other parts of China, and whether there's a difference in how severe the illness is depending on whether you were infected with the strain from Iran or the strains from China. So it's one of those really interesting scientific questions that's got our genomic scientists really excited.
Richard, Tanya, and Keith.
Do we know, in this latest case, do we know when she returned to Canada and how long, how many people, and for how many people she may have come into contact with?
Yeah, so she came back middle of last week, and she was not ill during her travel, became ill a couple days after returning home, but only one really close contact and very few other contacts at all. They were staying pretty close to home. And, you know, that's what we've asked people to do.
And you've been in touch with the close contact?
Absolutely. That close contact is in isolation.
Thank you.
Tanya.
Regarding your reporting of this, first of all, can you confirm how many people have fully recovered in BC? And also, once those people have recovered, are their cases still counted among the total number of cases we have in BC?
Yes. So our total number of people who've ever had this is 13. Of those, 4 have totally recovered and met the criteria for being allowed out of isolation, which is having 2 negative tests and complete resolution of their symptoms. There's another 3 people that have had resolution of their symptoms but have not yet tested negative twice. So they're still technically in isolation, or well, functionally in isolation, but they have recovered from their symptoms.
And you've committed to updating British Columbians whenever there's a new confirmed case. Given the increased number of cases being reported daily, sometimes multiple times daily, we've had these updates. For example, would you announce cases? Would there be a time when you say every 5 cases, or are you going to commit to doing daily briefings at the same time every day, regardless of the...
They're getting tired of seeing me.
Well, I don't know if they're getting tired of seeing us, but the truth is that, you know, we're going to continue to brief people as cases develop. I think that's the best course. And so right now we have no plans to do fewer briefings. We'll do the briefings as they're necessary to do. Dr. Henry will also be briefing every Tuesday, a regular briefing that will happen regardless of whether there are cases or not on that day. The reason there were 2 briefings yesterday was the first was the regular briefing, and then we had another update to do later that day. And in addition, on Fridays, you'll see the extent of the testing in British Columbia. I think it's fair to say that it's been a busy week. And so on last Friday, we published the numbers, 1,012 individuals, for 1,425 cases. So we're going to continue to do that so that systematically, and if that requires a daily briefing, that's what it will be.
Keith.
Just to clarify, this tour she was on, was it in India? And you said people on the tour were now across Canada. Are other members on that tour also now still in BC?
No, there's no other members in BC, but there are other parts of Canada where people were on that tour, so we'll be connecting with them for sure. And there's other people from other parts of the world. And yes, the tour was in India.
And secondly, should people be visiting long-term care homes as much as they have?
Yeah, so, you know, right now, there's a lot of things circulating. So we always have provisions in place in long-term care during respiratory season to keep people out who are ill. But I want everybody to be really, really cautious right now, whether you think you just have a cold or influenza or this. Please don't go to long-term care homes. We know how devastating it can be for elderly people, and this case is a case in point. It's very challenging for elderly people to recover from influenza. We know it causes deaths, many deaths every year, and this has been a devastating disease for older people, and we've seen that in the long-term care home in Washington State. So that just reminds us of how important it is to stay away, keep children away from long-term care homes. And if you are sick and you absolutely have to see your loved one in a long-term care home, and we know that happens because people, you know, people are there at the end of their life sometimes, then call ahead, talk to the staff, make sure that you can be safely, wear a mask, wear the important things, clean your hands, go only to that person's room. So there's measures in place to help support people if you need to be in to see your family member. But right now, please, anybody who's sick, please stay away from work, stay away from school, and in particular, stay away from long-term care and assisted living where people are very vulnerable to this.
Okay, we're going to take a question from Binder and then go to the phone lines.
So I just want to be clear on your answer to Keith when you talked about the woman who had the symptoms and she went to hospital. Would an average person who thinks they're sick, they would just go to a walk-in clinic perhaps? Probably, most likely, given the doctor situation, I guess, here in BC. Is that correct?
Yes, and so if people are concerned that they have an infectious illness, particularly if they think they have a travel history or contact with somebody and they might have this, call ahead. So call ahead to the clinic, call 811, and they can help you find the right place to do this safely and to be tested. Her condition was severe enough that she needed to have emergency care, so that's why she was referred to the emergency department.
And do we have a sense of how busy the walk-in clinics are? I know they are limited by the number of patients they can see in a day. Is that having an impact?
Not in any way. As we've gone through these particular cases and others, I mean, the key is to call ahead and to call through 811, and certainly arrangements will be made. We note that 811 services are available in well over 100 languages in British Columbia, so it's the right place to call to ensure that you get appropriate service. With respect to the issues on walk-in clinics or doctor's offices, we do have, as you know, urgent and primary care centers in many centers around British Columbia now that have come in the last little while. And so we're able to address this, although it's challenging. One of the things that we're asking both employers and employees right now, for example, is to not pursue the need for doctor's notes in these questions, because I think it's reasonable, even though we're not under pressure now, to think that we might be, and that lots of people are activated on these questions. So that's a good thing not to have to do in these times. And so I think we just expect people to be practical. But if there's a concern, call ahead, either to the clinic or to 811 in virtually any language that's spoken in British Columbia, and you'll get service.
Okay, we'll go to the phone lines. As a reminder, please press *1 to enter the queue. And we'll start with Stephanie Ip from the Vancouver Sun.
Hi there, it's Stephanie Ip with the Vancouver Sun Province Newsroom. Sorry, I may have missed it earlier, but can you go through the cases so far and which ones have been recovered so far? And by my count, it's just the first 4 cases are recovered. Is that correct?
That's correct. The first 4 cases are the ones that have recovered and been tested negative and are out of isolation.
Okay, Ashley Badwani from Black Press, go ahead.
Is Stephanie still asking? Oh, I think Stephanie got cut off there. Hi, I had a question to do with Washington State. Since yesterday, I think there's now 39 confirmed cases. Are we at this point recommending people don't go across the border here in BC or anything to that extent?
No, we are not recommending any border controls with Washington State. We're not surprised that they're starting to pick up cases. They've been doing extensive contact tracing, so these are people that we expect have had contact with the number of cases they've identified. Most of them have been related to the long-term care home that has had the outbreak. So I do expect more cases will be identified, and I know that they are very actively isolating people, quarantining people, and testing people. And so that's a reflection in the numbers that we're seeing.
Marcella Bernardo, News 1130.
About Hi, I was hoping to ask about, we're getting lots of calls to the newsroom from people who are worried about situations that they believe are not being managed properly by health workers. I guess, what assurances can you offer that all the protocols are being followed and that we're not seeing people who may have this virus just wandering around in crowds?
Yeah. Well, there's obviously no guarantees to anything that we do, but we do have a very low threshold that we've seen, the number of testing that we've done, the fact that most of the tests come back negative or positive for something else. So we do have a good sense that the people who need it are getting the tests that they need. And we are asking everybody to do their part right now. This is not a normal time. It's not a normal time for us in BC, even though the risk here is still low. But globally, we are all dealing with this crisis, and we're going to be for some weeks now. So we are appealing to everybody to take those personal precautions that are important for preventing transmission of illness, and that is the routine things that we do, like cleaning our hands regularly, covering our mouth when we cough, not touching our eyes and our face, and most importantly, right now, stay home. Stay away from others. To keep your children home from school, even if you think it's just a mild cold. We need to take all of those measures to protect our communities and to make sure that we're able to deal with this crisis that we're dealing with together.
Okay, coming back to the room, we have Tanya and Keith.
As you were speaking, I got a note from a colleague who says, a friend of mine just returned from India but flew there and back via Korea. He started having symptoms while in India. They took his temperature at the airport. He was fine, but now he's getting worse. Since coming home, he's tried several clinics who won't even let him inside. He's called 811, talked to the public health nurse who told him to go to specific clinics. Those clinics also wouldn't see him, and no one will see him about his symptoms.
Yeah.
Proper protocols, or if you're
exactly what's happening for an individual, and it may be, we don't know what the interaction was with the nurse on the call, and he may have been given other advice, let's just say. But the most important thing is for people to stay home, to self-isolate, and if they have concerns about their symptoms, then they need to try and access medical care. They can do that through a walk-in clinic, but they should take precautions. If he's feeling sick himself, he should cover up when he goes to a clinic and let them know that he's had a travel history and that he has these symptoms.
Is there concern though that we could start seeing a backlog at some of these clinics or overflow? Or
I don't think we are at this time. We have to prepare the system, and that's why what we want people to do is not go in it for unnecessary things. For example, I spoke about doctors' offices, but we have in Metro Vancouver, we have urgent and primary care centers now, 2 in Vancouver, 1 in North Vancouver, we've got 1 in Burnaby, we've got 1 in Surrey, etc., and 1 in Abbotsford, etc. So there are places for people to come, and I recommend if the individual has concerns, they should recall 811 and reconnect with the system. And so from our point of view, we're not concerned about that, but we are concerned, and this is why we're preparing the system, if our ability to contain this is under pressure in future. Right now, remember, we have, this is our 13th case. We've been reporting on cases for more than a month. We've tested more people, I think, than any other jurisdiction in North America. We have a low threshold for testing. And the fact that we've done 1,425 tests as of last week when we had 8 cases is an indication that we both have a low threshold and we're picking up other things, such as influenza, such as colds, obviously, and other things. So I think the system's responding well. If people have concerns, that's the way to interact with the system. And obviously, there's a lot more calling of these lines. We've seen an increase in calls to these lines. But I think that the system is responding well.
Okay, we're gonna, oh, Keith, go ahead.
Question from a colleague, sort of a follow-up to Tanya's there. Does BC have the capacity and resources to deal with a large-scale community outbreak?
So, this is our work in public health, is, how do we manage this? How do we do the containment measures that are necessary? And we've seen different ones in different parts of the world. So yes, we are prepared to do that. And we've been having discussions, an ongoing preparation, scenario planning, dusting off our business continuity plans so that we can put the resources into public health when we need them. We can set up and manage things like fever clinics if we get to that point. And so we've been progressively building that response. And, I am confident it will never be easy. And it's never, when we start having outbreaks, there's a lot of concern, a lot of fear. Sometimes there's a lot of unknowns at the beginning when you have cases and you're not sure who's linking to who. But that's the work that we do in putting those puzzles together and breaking those chains of transmission. And they've been able to do that in China despite the huge numbers of people who have been ill. And we've been watching that very carefully. We're watching what they're doing in Korea, where they have a very effective public health system, in Japan, in northern Italy. So we know the measures we need to take, and it's one of those things that's not easy. Sometimes it takes a bit of chaos, but my job and our job is to minimize that chaos and to make sure we're as prepared as we can be, recognizing that there may be things that turn up that we've not planned for. But if we at least have a general plan and a general approach and we're sticking to it, we're able to try and minimize the amount of confusion and get us through this. And we will. This is not the first time we in BC have been through a pandemic. We can do it, but it's not easy, and the more that we can prepare ahead of time, the more people think about the things that they can do, the way we can get businesses prepared for the potential of people being sick or having to go home and look after people who are sick. How can we manage with our separation in our communities and in our societies to get us through this together?
And I just think this is what obviously we've been preparing for. It's why Dr. Henry and Mr. Brown were set up well over a month ago to start to prepare. But that doesn't mean it's going to be easy for anybody. It's going to be a challenge for the system, but it's also going to be a challenge for society. And that's why we're asking people to empower themselves, to take their own precautions, which means washing their hands. And we emphasize this again. It means throwing away Kleenexes. It means if you're sick, stay home. This is a precaution for people, and it's our duty to one another in the community, and that's what we need to do.
Okay, we're going to go back to the phone lines. We have Shrishti Ganji on the line.
Yes. Hi.
So just on the Washington cases, King County officials just today released recommendations, and that includes recommending that people avoid large gatherings. I know you're not recommending people stop crossing the border, but if they do, are you recommending that they, stay out of areas where there would be a lot of people gathering?
Yeah, this is something that we think about all the time, and we talked about that a little bit in the last week. There's a couple of things. One, if you're sick yourself, don't travel. That's really important. If you're somebody who is more likely to have severe illness or consequences from this or from other respiratory illnesses, then maybe consider postponing your travel or going another time. And yes, we've recommended people who are ill or who are at risk of having severe illness to avoid gatherings at this point. And we also want to anybody who's recently traveled and who might be at risk of having this virus should also not attend any of these. So those are the things that people who are organizing these big gatherings need to think about right now for the situation that we're in. We may be at a place where we also would recommend that people are not gathering in large amounts, and it will depend, of course, on what happens with the infection in our community here. I think we can, right now we're safe in our communities in BC, but we do need to take precautions, and we do need to think twice about going to large gatherings. And if we do go, we want to make sure that we take all the precautions that we need to try and keep ourselves healthy. So washing our hands, not touching our face, staying away from others if they're looking like they're coughing and sneezing as well, and making sure that those gatherings have the ability for people to do that safely.
James Fung, Tsingtao.
Dr. Henry. Hi, Dr. Henry. I just want to know the age of the new case, and also if she has a chronic disease, and also I think her last destination is Hong Kong. So did you notify the Hong Kong that we have this case?
So this is a woman in her 80s, and yes, she does have a number of underlying medical conditions that would put her at risk of having more severe illness. And yes, through our protocols with the Public Health Agency of Canada, we have what's called the International Health Regulations. We have notified Hong Kong.
Okay, we have Andrea Wu from the Global Mail. Go ahead.
Hi, Dr. Henry. You had mentioned before that BC had added COVID-19 testing to the province's existing influenza surveillance network. And I was wondering if there are any other measures that we're taking here to proactively look for transmission within the community.
Yeah, so we are looking at SARI, or severe acute respiratory illness, in our hospital systems, and we're looking at any of the swabs that are taken for potential clusters or outbreaks as well. It's a challenging thing to do because this is still a rare disease in our community, so when it's hard to test everything. Influenza testing is done in several different places, but we're doing the vast majority of it will also be tested for coronavirus. So the best we can do is we're still working with the scientists, particularly at BC CDC, to see if we can come up with a more coherent strategy to get broader reach in the community. But this is our first step for the surveillance, yes.
All right, any other questions in the room? No? Great, thank you, Minister.
Thank you very much.